It's like it's worse.
Right.
Yes, exactly.
Listen, I have one more question that's different and it's real good. Why are, and I think people don't know this, why are California insurance carriers allowed to threaten agents' commissions? The agent's group client uses certain high deductible plans in conjunction with HRAs. This prevents employees from lowering the cost of the health plan for its employees. And Ralph, would you address this issue?
Using a high deductible health plan, it goes without saying that high deductible is lower cost. That just makes sense. When an insurance company prices out a low deductible plan or a plan that has what they call an office visit copay, that's really, you should call it a penalty fee for seeing the doctor. It's a $25 penalty each time you see the doctor, not an office visit copay. They make insurance companies, traditional life insurance, where you pay $20 a month for 50 years, they make interest on that money for 50 years. Health insurance it's not really insurance, it's money in, money out. So they try to micromanage by having low deductibles and making just a couple of pennies on more than a couple of pennies, but just a few dollars on each visit. In every state outside of California, there's a federal, well, actually it's in California too, there's a federal statute, section 105 of the Internal Revenue Code, that says that you can reimburse medical expenses. An employer can reimburse an employer medical expenses that they have incurred. So what employers do in every state outside of California is they get a high deductible plan and they say, we'll kind of self-insure on a pay-as-you-go basis for the routine expenses. It's very cost-effective. It's very efficient. It's a very good way because, as I said earlier, we should insure for known routine costs. This takes that out of the formula. And in 49 states, that's done. In California, the insurance companies are preventing employers from doing it. And they're saying two things. Number one, they're telling agents, if we find out that you know about this, we're going to cancel your contract, we're going to stop paying you, not just for ABC Widget Company, but for every company that you've written with us. We're going to stop paying you. And because it's an at-will state, they feel that they can get away with this. They also tell employers that if you are caught reimbursing your employees for these costs, we will rescind your contract. Okay? Now, nobody really knows why they do it. I think one of the obvious reasons is they want a bigger piece of the pie. They want the higher premium plans, especially if we have a mandated medical loss ratio. They will need to keep the premiums up, and this is one way to keep the premiums up by having a lower deductible. I think another big reason is if employees started paying for routine care, routine costs, and the employer helped them to pay for those expenses, suddenly the insurance companies would lose data. And I have heard all kinds of numbers about how much we use per year on routine expenses and medical expenses. I think I've heard that 80% of people use less than $1,000 per year. So if 80% of the population suddenly didn't call the insurance company 3 times a year saying, oh, I'm going to the doctor, I'm having this exam and that exam, and the doctors feed that information back to the insurance company, all of a sudden the insurance companies lose data. And they use that for pay for performance, then that system is all gone. If 80% of claims were paid on a pay-as-you-go basis by the employees with the employer reimbursing, all that data would be gone. It's not a fair playing field. It disadvantages small employers in California. In other states, they do it. In my opinion, I don't think an insurance company has the right to override a federal statute and also override the state insurance code. Okay, but so far they're doing it, and I'm sorry?
How do they do it if they
Yeah.
don't have the right to do it?
I've got one of those programs. One of those insurance policies.
Right.
Unfortunate.
Oh.
I have dual coverage.
Right.
My employer, unfortunately, the county that I'm retired from becomes my primary, and I take the bare bones program just to keep the insurance. My husband's policy, he's retired, has to then become my secondary, which I'm automatically covered under because we pay the premium, we're both covered, and his is a more comprehensive program, so I have to jump through the hoops. Go through, this qualifies, but you haven't met your $5,000 deductible. Then we fall back on his, which pays as if it's primary. And, that sounds like a really good deal to me.
Right. Well, there are, one second, there are some carriers, and Kaiser is the latest. They have said you cannot get, not only can you not, as an employer, you know, if you get a high deductible plan, your employees are on their own. You can't help them. If they can't afford it, you know, that's their problem, okay? You can't be a good corporate citizen and help your employees with these out-of-pocket costs. They've actually gone a little bit further now, and they've said you cannot get supplemental coverage. And by supplemental, I mean stuff like, you know, Aflac and Colonial, where it pays for accidents and, you know, and stuff like that. They're saying you can't get that. It would be, in my mind, it would be something like if Toyota said, you can buy our car, but you cannot get floor mats from Walmart, you can't get a stereo from Best Buy. You have to get it all from us at our price. Okay? That's the parallel that I draw.
I brought the question up because, first of all, I want to be a Assemblyman to know the impact that this is having on employers across the state. In different areas, it's costing employers anywhere from 25 to as much as 40% that they could be saving if the insurance companies would not restrict these plans. Which area are you from, Serena?
San Joaquin, Sacramento.
We've got plans there that are being restricted from employers where employers could reduce their plan cost by 25%, yet the employees would end up with better benefits. The agents won't show those plans for fear of having their commissions withheld or their contracts canceled. Insurance agents are afraid to bring this up because it's an at-will state and they know the insurance company will cancel their contract. That's why we've taken the initiative to raise this issue, hopefully getting more people involved like we've got here in this room.
How can the state override a federal mandate like that?
Sounds like it's intimidation.
The state isn't overriding the mandate. The insurance companies are doing it and getting away with it because the regulators are not stepping in to ensure.
Okay, that's what I wondered. It's the insurance companies that just do it and get by with it.
Nobody
I mean,
challenged it before.
any employer has the right to take them to court. But what employer can afford to take Blue Cross or Kaiser to court? Okay? So they're just relying, you have the right to take them to court as an employer. They're relying on the fact that you probably won't.
Okay.
Dr. Malakowski has.
Was it? You asked a question?